Good afternoon. Welcome to the EMA office here for day 405, where we bring you the latest in the numbers on the COVID. I'm joined here with Chairman Mark Kern today and also Assistant Director Brian Whitaker. Brian, you've got the numbers from the Health Department today.
Yes, sir. In St. Clair County, we've tested 332,367. That's an increase of 873 since yesterday. For positive test results, we're at 30,122, which is an increase of 33 since yesterday. Those are males and females under the age of 10 up to their 70s. That brings our daily county positivity rate to 3.8%. For negative test results, we're at 302,245. We are happy to report no new additional COVID-19 related deaths today. That means the countywide death total remains at 475. For those that have completed their IDPH required 10-day isolation period, we're at 29,307. For state totals, they've tested 22,008,695. Positive test results of 1,312,722, which is an increase of 3,170 since yesterday. Sadly, the state did report 33 new COVID-19 related deaths, bringing the statewide death total to 21,755. For hospitalization numbers, those hospitalized in St. Clair County hospitals, we have 22 patients admitted due to COVID-related illness, and 3 of those patients are on ventilators. Regionally, there are 45 patients admitted due to COVID-related illness, with 3 patients on ventilators. There are no changes in our congregate living facilities today. And as we talk about every day, and as these numbers continue, still so vitally important is the testing. If you feel you've been exposed to someone or you're displaying any type of symptom, you should always go get tested to rule that out. That way you could be isolated in the event you are positive for COVID-19. Testing is available Monday, Wednesday, Friday, and Saturday at St. Clair Square from 8 a.m. to 4 p.m. and also at various pharmacies and urgent care facilities throughout the county. I'll now turn over to Chairman Kerr for his update.
Thanks, Brian. The ventilator number is up today.
It is, up since yesterday. And unfortunately, everyone on a ventilator in the region is here in St. Clair County.
So it's out there, and of course that ventilator number is one that's always really affected us, because that's where you don't want to go. That shows the seriousness of this virus is out there. Get tested, wear your mask, watch your social distance, and get that vaccine, and wash your hands. That's for sure.
Yes, sir.
Thanks, Brian. Okay, let's take a look at the zip code. 62201 is up 1 today to 600. 62203 goes down 1 to 654. 62206 up 4 to 1,364. 62207 up 2 to 606. 62208 up 1 to 1,694. 62220 up 1 to 2,150. 62221 up 4 to 2,873. 62223 up 3 to 1,828. 62232 up 1 to 927. 62243 up 3 to 798. 62260 up 1 to 830. And 62269 up 6 to 3,372. 33 new positives today, 873 people tested, brings our county positivity down to 3.8%, but our rolling average, because of yesterday's uptick number, goes up to 4%. The regional positivity, though, is down to 3.1% today, and that's derived by all our counties that are with us in the region, which include Bond County, which is at 2.6% today, Clinton County, 4.1%, Madison, 3%, Monroe, 2.5%, Randolph is a negative 0.4% today, St. Clair is at 2.7%, and Washington County, again, is 0%. So those are all good numbers in the region. Herb, good to have you back joining us today. 3/4 of those people who contracted COVID, we're under the age of 40 today. You know, that number, this graph that we show really is becoming tells a real story, that now 3/4 of those that are getting infected are under 40 years of age. That's just a total shift from what we saw for a long time through COVID-19. Now that the vaccines are out and people have been vaccinated, it's pretty clear that we've got to get to the people who are under 40 and make sure they're getting their vaccine, because they're the ones now that are really showing up with COVID.
Well, as you said, we've watched that number for the last several months, you know, of being under the age of 40, and we've watched that increase. And, you know, across the state, 3,170 new cases. That is just more proof that the virus is still out there actively in the state. And we can't let our guard down, more so now than ever, because we have came so far, 405 days. And the last thing we want to do is go backwards. But if we let our guard down, then we're all going to be sitting here saying, you know, why did we do this? We know what happened. There's no excuse, really.
And it's been a long time. I mean, you know, we talk about it, 405 days. People are getting worn out, and we understand that. We're worn out on this too, but we've got to remain vigilant. We have to keep following these rules for a while longer. We hope it's just going to be about a month, and we'll be able to kind of get through the weeds of COVID-19. That's what initially all the pundits seem to say. So we're going to continue to focus on that Memorial Day time frame when, you know, we'll be able to just start walking out in the world again as we remember it.
You know, and I agree with you. A lot of times I don't, but you've said that Memorial Day for a long time now. And as I look at these numbers, and Brian and I, we go over them every day before you get over here. It looks that if we can get through to that Memorial Day, I mean, I think that should be our target. You know, we need to draw that line in the sand and say, come on, let's all shoot for that date. Give us all something to work for. So, Team St. Clair, let's make that Memorial Day that day that hopefully we can say that we put this behind us and deal with the new norm that we have, because for 405 days we've all been waiting for that day. And our National Guard troops they're there. Of course, I don't think they ever get wore out. I mean, they just keep going and going and going. Our medical staff from the health department down at the Mass site has just been tremendous.
And think of the hospital staff. I mean, you have 33 new positives in one day. Those are people that are being treated in St. Clair County in our hospitals. That's the 405th day when they've seen COVID patients coming into their facility. Talk about worn out. They really have put forth the yeoman's effort, saved a lot of lives, and learned a lot throughout this whole process. And they're putting it all to work, and that's why we think that the numbers continue to look better, is because of all the hospital administrators, doctors, nurses, staff, everybody that's put this together, along with those who created the vaccine and those who are giving it out.
Exactly. You know, we can't forget, you know, 33 more deaths across the state of Illinois. Another number that is just clear evidence that the virus is still out there, and it will attack anywhere, any place, anybody. There's nobody immune to it yet, and you can do that by getting your vaccine. There's no reason why. We here at Team St. Clair has tried to make it as easy as possible to get your vaccine down there. Don't even need an appointment. Between 9 to 5 each day, except for Wednesday when we're closed at the fairgrounds. Drive up down there, they'll register you to get it. I think, Brian, what was it, another 100 and some people drove in?
110 today that didn't
Showed
have
up,
appointments
didn't have
that got registered
appointment,
on site.
showed up. So if you're out and about until 5 o'clock tonight, you said, hey, I want to get it, there's no reason why not to get it. So drive on down there and just get a needle in the arm and get the process started, and we'll be one step closer to getting this problem under control. We'll be back with Cindy in just a few moments to translate this into our Spanish communities, and then we'll be back tomorrow for day 406. Everybody have a good evening.
I was born and raised in East St. Louis, St. Clair County, City of Champions. We band together like family on picket where the Mary Brown Center in Lincoln Park was my playground. Just as we were together then, we must all band together now and work to combat COVID-19. As an Olympian, I understand the importance of teamwork and overcoming hardship. So I plead with you to do what I'm doing to fight this virus. Wash your hands, wear your mask, watch your social distance. It takes teamwork, and if we stick together, we will victoriously cross the finish line.